Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
Chronic obstructive pulmonary disease, COPD, is a progressive lung disease characterized by airflow limitation that makes it difficult to breathe. The history of COPD can be traced back to ancient times, with evidence of lung disease described in ancient Egyptian papyri and Greek medical texts. However, it wasn't until the 20th century that COPD was formally recognized as a distinct clinical entity. In the early 20th century, the term chronic bronchitis was used to describe the chronic cough and sputum production commonly seen in individuals with COPD. Over time, it became evident that COPD encompasses a spectrum of lung diseases, including chronic bronchitis and emphysema, which share common features such as airflow obstruction and respiratory symptoms. History of COPD. While COPD has been recognized for centuries, it wasn't until the 20th century that it became formally defined and understood as a distinct clinical entity. Early descriptions of lung diseases resembling COPD can be found in ancient medical texts, but it wasn't until the Industrial Revolution and the widespread adoption of tobacco smoking that COPD began to emerge as a significant public health issue. Throughout the 20th century, advancements in medical science, including the development of diagnostic tools such as spirometry and imaging techniques, as well as increased awareness of the harmful effects of smoking and environmental pollutants, contributed to our understanding of COPD and its management. Symptoms of COPD typically develop gradually and worsen over time, often leading to significant disability and reduced quality of life. Common symptoms include chronic cough, sputum production, shortness of breath, dyspnea, wheezing, and chest tightness. These symptoms are often progressive and may fluctuate in severity, with exacerbations, flare-ups, triggered by factors such as respiratory infections, air pollution, or exposure to irritants such as tobacco smoke. Treatment of COPD aims to relieve symptoms, slow disease progression, and improve overall lung function and quality of life. The cornerstone of COPD management is smoking cessation, as cigarette smoking is the leading cause of COPD, and quitting smoking is the most effective way to slow disease progression and reduce symptoms. In addition to smoking cessation, other non-pharmacological treatments for COPD include pulmonary rehabilitation, which combines exercise training, education, and behavioral interventions to improve exercise capacity, reduce breathlessness, and enhance self-management skills. Nutritional support, supplemental oxygen therapy, and vaccination against respiratory infections such as influenza and pneumococcal pneumonia are also important components of COPD management. Pharmacological treatments for COPD may include bronchodilators, which help relax the muscles around the airways and improve airflow, and inhaled corticosteroids, which reduce airway inflammation and may be used in combination with bronchodilators for individuals with more severe COPD. Oral medications such as phosphodiesterase 4, PDE4 inhibitors, or roflumilast may be prescribed for individuals with severe COPD and chronic bronchitis who continue to experience exacerbations despite optimal treatment with bronchodilators and corticosteroids. Prevention of COPD involves minimizing exposure to risk factors such as tobacco smoke, indoor and outdoor air pollution, occupational dusts and chemicals, and indoor biomass fuel combustion. Smoking cessation programs, clean air initiatives, workplace safety regulations, and public health campaigns promoting awareness of COPD risk factors and symptoms are essential for reducing the burden of COPD worldwide. Additionally, early detection and prompt intervention through screening programs and access to healthcare services can help identify individuals at risk for COPD and implement preventive measures to reduce disease progression and improve outcomes. In conclusion, COPD is a complex and progressive lung disease with significant implications for public health and individual well-being. By addressing modifiable risk factors, promoting smoking cessation, implementing comprehensive management strategies, and supporting ongoing research into new treatment modalities, healthcare providers and policymakers can help mitigate the impact of COPD and improve outcomes for individuals living with this chronic respiratory condition.